Welcome back, everyone. I hope you had a good lunch break. My name is Michelle Squires, and I am the Director of Public Policy at CMHA Ontario. It now gives me great pleasure to introduce our dynamic keynote panel, Collaborating for Change, Disrupting Homelessness and Justice Involvement. Please note that the panelists' full bios are available through the conference platform for your reference. If you have any questions to the panel, please type them in the Q&A box at the bottom of the screen, and we will try to get to as many questions as we can during the Q&A period at the end. I'd like to first introduce our moderator to the session, Sophia Hussain, Director of Policy with the John Howard Society of Ontario. Welcome, Sophia. And next are our panelists. We have Krishni Ganesan is the Director of Policy and Mental Health and Addiction System Transformation with Addictions and Mental Health Ontario. We have Michael Jasek, a Senior Policy Advisor at the Association of Municipalities Ontario. Aaron Stout is the Executive Director of Ontario Municipal and Social Services Association. And we will also have Robin Holmes, the Assistant Executive Director of John Howard Society, Kingston and District, who will be presenting our program spotlight after the panel discussion. With that, I would like to turn it over to Sophia to begin.
Thank you so much, Michelle. Hi, everyone. It's a pleasure to be here today moderating this panel and to be part of this conference. I wanted to start off with a couple words just to talk about the John Howard Society of Ontario, our connection to this important work, and to introduce the panel topic today. So the John Howard Society of Ontario works to build a safer province through applied research, policy development, public education, and advancing evidence-based solutions to challenges in the criminal justice and social systems. We're also part of a network of JHS offices that provide critical services and programs to individuals of all genders, ages, from prevention services to programming inside correctional institutions to housing and reintegration supports. Housing has been a key focus area for us for some time. We know all too well about the cycle of justice involvement and homelessness. Through our research and policy reports over the past few years, including one released this July, we know the proportion of admissions to Ontario's provincial jails of people who are unhoused or have no fixed address is increasing. We also know incarceration can cause housing loss due to income assistance being cut off, loss of employment, and is particularly true for individuals who lack social supports. And as a result, we estimate over 7,000 releases each year go right from jail to the streets or an encampment or shelter, often with unmet complex needs. And we know the solution: housing with supports. We're here today because we know the challenges facing some of our most vulnerable community members cannot be solved by any single organization, system, or sector working alone. These are complex, interconnected issues that demand from us something that's equally complex: deep, sustained collaboration. Today's panelists represent some of the very partnerships we need: community mental health and addiction services, justice organizations, municipalities, and social services. Together, they're going to share how breaking silos and building truly integrated person-centered approaches can disrupt the cycles that trap too many people in crisis. But collaboration among service providers is only part of the story. We'll also talk about how education and genuine community engagement can help us move past resistance and fear, aka NIMBYism, and toward understanding. Because when communities see the real outcomes of supportive housing, fewer encampments, reduced emergency calls, increased public safety, perceptions can shift. Safer and healthier communities are built when we invest in solutions that work for everyone. And that's work that starts right here with inclusive dialogue, meaningful collaboration, and a shared commitment to housing as a fundamental human right. So let's begin. I'd like to introduce the panelists and allow them to give a brief introduction on their role, organization, and their interest in speaking today. So I'll start with Krishni.
Thanks, Sophia, and thanks to HSJCC for the invitation to speak today. So my name is Krishni Ganesan, and I'm the Director of Policy and System Transformation at Addictions and Mental Health Ontario, or AMHO. And we are a member-based organization of over 150 mental health and addiction service providers across the province who provide a wide range of services, including supportive housing. And supportive housing has been one of AMHO's key advocacy priorities and key policy and research priorities. And earlier this year, we released some research on specifically mental health and addiction supportive housing, how many folks are on waitlists right now, and what we can do as service providers at a municipal level, provincial level, and federal level to get supportive housing built and get people who are experiencing homelessness housed and adequately supported. So really, really excited to be here today and to have this discussion.
Thanks so much, Krishni. Michael, can you go next?
Sure. Thank you for the opportunity. So Michael Jasek, I'm a senior advisor with the Association of Municipalities of Ontario. A little bit about my association, AMO. So AMO is an association. We're membership-based as well. We represent the 444 municipalities across Ontario. And basically our mandate is to strengthen municipalities. And we do that in a variety of different ways, so that they can help improve the quality of life for their residents and do that in a sustainable way. We work we work with the provincial government and the federal government. We provide a voice to municipalities for advocacy, and we're politically governed by elected officials. So in that sense, we're a political organization, but we're strictly nonpartisan. We work with the government of the day to have productive dialogue and to advance certain causes. My role at the association is essentially to do policy development, to bring recommendations to my board, and then to engage in government relations in order to be able to promote those policy solutions. And I do work quite primarily on social policy. Housing and homelessness are a big part of my portfolio, and I do work quite closely with colleagues in the health policy area because we feel that needs to be integrated. And just my interest in speaking at this conference, social policy issues like homelessness are a top priority for our board right now. We know that justice involvement in incarceration can lead to homelessness and vice versa in a perpetuating cycle. We think this needs to be addressed through policy funding and procedures by all orders of government. And we continue to pursue that, working with partners. And I'm hoping to learn from my co-panelists today and what I think is going to be a very interesting session. Thank you.
Thanks so much, Michael. And over to you, Aaron.
Thank you. I'm Aaron Stoke. I'm the Executive Director of the Ontario Municipal Social Services Association. We work very closely with AMO as kind of a partner organization. We represent the 47 municipalities across municipalities and district social services administrative boards across Ontario that provide income assistance, housing, homelessness, and children's services. And we work with them through, shaping their policy positions, working with the provincial and federal government around policy changes, as well as sector capacity building. So sharing best practices and supporting our members to deliver these services to Ontarians.
Great, thank you all so much. So to begin, we're going to take a step back and look at the broader landscape here. Each of you bring a distinct perspective to intersecting issues like health, housing, mental health, and justice. And so for this first round, we're going to look at identifying some of the key gaps, challenges, and barriers to supporting underhoused and vulnerable communities. So Erin, I'm going to start with you this time. Some of the challenges to best support underhoused communities exist due to multiple systems that often operate in silos. These include the health, community mental health and addiction, housing, and criminal justice systems. What are the biggest service gaps you see, and how can service providers break down these silos so that systems can work better together?
Yeah, so I think, as anybody who knows me or seen me speak on a panel, I'll often start by reframing something, which is I think there's been a lot of work happening over the last couple of years in order to close those service gaps. I think you've seen municipalities step into a significant role of community convener, connector, and building those alignments. And I think you've seen that work both happening at a local level as well as at a provincial level. Last year, OMSA, AMO, and NASDA partnered to release the Municipalities Under Pressure report that highlighted some of the things that are needed to close those systems gaps. There's a couple of real specific areas that I want to comment on in terms of what we're seeing currently as some major challenges in terms of system gaps. I think the first one is discharges from both the justice and the health system. And where those discharges are happening to people that are facing housing precarity. There is, I think reasonably both systems want to move people out of inpatient treatment or being incarcerated. Both of things that I think we can all agree on are good and we want to see. But often those are done without sufficient planning in order to make sure that that person is being discharged into stable housing to support their journey back into community, and in doing so, it increases that housing precarity. I think additionally, we continue to see system gaps between capital expenditure and things like supportive housing and the operational support, operational funding needed to sustain that supportive housing. So you'll often see, the capital approved from whichever level of government is doing that, but it hasn't come with the supportive housing operational dollars that are needed. And so there's always a risk that you've got this housing that's been developed, but you can't place people within that housing. And then I think, another area of disconnect is there's a real disconnect between the things that social housing providers or my members are held accountable to in terms of our agreement with the province, and that of which the mental health and addiction system is funded. And so there's not enough alignment at the provincial level about what the expectation of both of those systems are, what the overlap between those systems are, where they're meant to collaborate, where they're meant to prioritize each other's clients, all of those things. And, I think that requires, that creates a challenge. I think, from my experience, the two areas, obviously, we need to continue to have dialogue with the provincial government and organizations like AmHome and AMO and OMSA need to collaborate so that we're going and taking a common narrative. But one of the things, regardless of what sector I'm speaking to these days, I'm really trying to emphasize that we need to not wait for government, right? We need to take action on the ground. And I think there are lots of examples of deep collaboration that have happened at a local level to set up local protocols, local standards of service that really overcome some of these gap problems. And that, both sides of the equation, whether it be health, justice, mental health and addictions, housing, come together and establish baseline standards of how they will operate together. And that's something that every community in Ontario can go and do starting tomorrow and not wait on government. I'm not suggesting we should stop advocating for system improvements to government, but I think both things need to happen simultaneously.
Thanks so much, Aaron. I think that's really important to highlight where there are improvements and we're seeing that increased collaboration, and especially on a local level, because it's not always about reinventing the wheel. Some local areas are doing really innovative collaborative work, and others can sort of look to some of those models as well. Thank you so much. Krishni, I'm going to turn to you next. What do you see as a practical yet ambitious solution to address a major system challenge, such as access to housing?
Thanks, Sophia. And I mean, we've already started to talk about it, but supportive housing is a really great way to address the overlapping crises of homelessness, of the toxic drug supply, of a large increase in the incidence of severe mental illness. And it is something that does require, as Aaron was mentioning, a lot of collaboration across multiple different systems that are funded by not only different provincial ministries, but at the municipal level as well as federal level. But at the end of the day, supportive housing itself, I'm sure most of the folks on this call knows, is that combination of housing assistance plus support services that are tailored to the individual. So at AMHO, we are focused on mental health and addiction supportive housing. So those support services might look more like counseling, case management, life skills training, addiction support, but can look different if the client has physical disabilities, developmental disabilities, etc. The intention is to, serve the client in the way that they need. And I think especially with justice-involved individuals, where access to housing can be challenging due to people's criminal records, supportive housing can be that game changer to connect them into housing. I mentioned this earlier, that AMHO worked on a research report earlier this year where we looked at mental health and addiction supportive housing in the province, and we found that there's around 25,000 units of housing, but also found that the wait list for supportive housing exceeds 36,000 people, and that people are waiting over 4 years to get access to housing. And in that interim period, they are either experiencing homelessness, they might be marginally housed, they might not be in situations that are safe or supportive to their wellness. And I think as, we try to navigate red tape and navigate all of these different systems, it is really important for us to think about the actual people that are waiting, and potentially decompensating as they wait to be placed into something as simple as housing. And when you mentioned it at the beginning, housing is a human right, and so many people across this province are not able to access that essential right. So I think across the province, across the country, there's a huge desire to end homelessness. And I genuinely think the most sustainable solution to that is to invest in supportive housing. It benefits the tenants, it benefits communities, it benefits our province, it benefits all taxpayers. But as Aaron mentioned, there is a lot of work that needs to be done to align funding, to align accountability, to create regional models that make sense, and that can be scaled and adapted as needed for, a local or a regional context.
Absolutely. Thanks so much, Krishni. I think you really nailed it then on the benefits to individuals and society as a whole. And we know that your report listed out some costing as well, like the cost of incarceration as well over $13,000 a month, but supportive housing is around $2,000 to $5,000. So we know this benefits individuals, but also our larger systems. Michael, I'm going to turn to you next. Ontario is unique in having municipalities directly responsible for delivering social services. How does this local accountability help or hinder efforts to disrupt the cycle of homelessness and justice involvement?
Great, thank you. It's a great question. Happy to answer it. I think my contention up front is that local accountability helps rather than hinders, but there are some challenges that we need to overcome, and I'll explain that a little later. But first of all, would I like to start with a little bit of context, a little bit of Municipal 101 for people that may be less familiar. So Ontario is unique in the Canadian Federation. Unlike other provinces and territories, we are responsible for human or social services, as you mentioned in your question. And along with community partners, we're on the front lines of crises in our community, from homelessness to mental health and addictions and housing affordability. The human services that municipalities deliver address the social determinants of health. They play a role to disrupt the cycle of homelessness and justice involvement. There includes a broad range of services that our municipal service managers deliver, include housing, homelessness prevention, social assistance, and childcare. And there's others as well in the health space, long-term care, paramedic and community paramedicine, which is also part of the homelessness response, and public health as well. And while it's not mandated, we do know that many of our municipalities are also in the mental health and addiction space, often funding services and directing services, usually contracting them for others to deliver. But through the municipal service system managers, the 47 that Aaron talked about, they plan, fund, and manage service provision in their communities. They do this by developing and implementing service plans for their areas. One thing of note is that they are responsible and legislatively responsible under the Housing Services Act to develop 10-year housing and homelessness plans. And I think that's a really great opportunity to do some comprehensive planning and have some accountability. The service managers, they're accountable, of course, to their provincial and federal government funders, but most importantly to their local residents. This is because they're expending property tax revenue to deliver services that's intended to raise the quality of life in communities so that they're socially and economically prosperous. So I would say that local accountability works. I think it follows the subsidiary principle that services are provided by those that are closest to the people. I believe there's a one size does not fit all advantage. Municipalities know their communities more than the provincial government, and they can provide services in a way that meets local need and circumstances. And they partner with the community sector, funding, leveraging, consulting, and sometimes joint governance arrangements to aid planning. So getting to a couple challenges, I'd be remiss if I didn't talk about funding. One challenge is that municipalities can't do it alone or primarily themselves. They are dependent on other orders of government for funding, and despite significant investments by municipalities, there's clearly a need for more investment. I do agree with Aaron that we can't wait for government, but we do need those investments. Municipalities contribute about $500 million into homelessness prevention services and over $2 billion on affordable housing on an annual basis. So our contention is that's not quite sustainable. We've talked to the government about a social and economic prosperity review to look at these financial arrangements. But another challenge that I'd like to talk about that Aaron mentioned is a little bit about the fragmentation of the system. And I agree that municipalities are doing a lot of work on the ground to sort of bring these different systems together. But in terms of responding to homelessness, service managers only manage parts of the system, as we all know. They do the majority of the homelessness service system, but not all. Violence against women shelters are outside of municipal service managers' purview. They do provide the lion's share of housing, but supportive housing, as you know, is funded through the Ministry of Health. And the systems are separate and not as integrated as they could be at the provincial level. And I'm not suggesting that service managers would, take on management of these other parts of the system, but the systems that Aaron talked about are not tied together, I think, by an overall provincial-wide strategy. So I think, municipalities and DSABs can help meet the social determinants of health to reduce poverty, addressing homelessness as its most extreme form. Aaron had talked about our homelessness report that we had done jointly together. And in that report, there were solutions proposed, and it assumed that all those systems would be working optimally together in an integrated fashion. So I think we need to work together to integrate policy, service planning, and delivery so that we can operate at that optimal level. And I think this would be facilitated by an all-the-government approach, federally, provincially, and municipally. And I think there's shared accountability that needs to be in place without putting most of the onus on municipalities. Thank you.
Thank you, Michael. Yeah, your report really had some staggering numbers around homelessness, and I think you raised some really important points about the importance of a multi-government approach that does allow for sustained investment, to allow for those locally grown approaches to respond to community need. That's great. So we're gonna shift now in the next round of questions to talk a little bit about collaboration and community. We know progress happens when people and systems come together. I'd like to hear how partnerships and local voices are shaping better outcomes, and how community attitudes like NIMBYism influence our path forward. So kind of taking it to that local level. Michael, I'm going to start with you this time. What role can municipalities play in amplifying the voices of people with lived experience, so local decision-making reflects community realities?
So I'll say up front, I think that we all agree in the audience about the critical importance of engagement and amplifying the voices of persons with lived experience. Municipalities do engage currently, but they can always continue to strengthen their role to do this. As you know, I think there's a recognition that local decision-making can only reflect the community with the meaningful involvement of persons being served. And this can happen in a variety of different ways. And of course, this varies by municipality or district social service administration board across the province. There's engagement with service provision, tenant advisory groups in shelters, engagement with people living in encampments, transitional housing, and community housing. I think for this, it's very important to follow the principles developed by people with lived experience to follow. Consultation occurs on annual service planning, the 10-year housing and homelessness plans that's underway in communities right now as they seek to renew their 10-year plans. Governance is another way. Different governance arrangements can inform decision-making at a higher level. And I think it's important where possible to get the voices of people with lived experience before municipally elected officials. Staffing is another way that municipalities can work on this, elevating people with lived experience into leadership roles with the ability to influence and make decisions. But one of the things I'd like to talk about, sort of following up about the report that we did on homelessness last year with AMSA and NASDA, is the collection of data to inform planning policy and the allocation of resources. I think through data, both quantitative and qualitative, it really helps tell the story of individuals and brings out the voice of persons with lived experience. And that data can be collected in a variety of different sources that we're familiar with: by name lists, enumeration counts, needs assessments, service provision, and program evaluation. And I think it's critical that we use that data points as information inputs to guide the system response. And I think we need to learn from it to adapt and lead change. The homelessness report that was referred to was a big data collection exercise, and I would say that it gave some representation to people experiencing homelessness at the systems level. We documented and quantified the number of people experiencing homelessness in the province, over 80,000 in 2024. So that group is here and needs to be paid attention to. About half of that number was chronically homelessness, many unsheltered and unhoused that were stuck in the system, and we came to the conclusion they need housing more than emergency response services through shelters. We also collected socioeconomic data to demonstrate the disproportionate impacts on different groups. Of course, we know that Indigenous people are overrepresented, but we also talked about asylum seekers, and a new development that we learned is that there's a significant portion of children and youth that are in the chronic homelessness population, about 24%, which we found a little shocking. We didn't have it within the scope to talk about justice-involved individuals in the project, but I think that would make for future interesting work. And we're using that data to advocate to the provincial government, and I believe that service managers are using this to inform their planning. And in closing, I just say that I think that amplifying the voices of people with lived experience can happen and should happen, and it can happen in a variety of ways.
Thanks so much, Michael. Yeah, I think that combination of data and amplifying human stories is really powerful and important. Krishni, I'm going to turn to you now. How do the attitudes and narratives surrounding NIMBYism shape the way individuals and communities see themselves, their worth, their identity, and their place in the community?
The big one. And I think we've seen this play out in the media, in traditional media and in social media for many years, but I think especially in 2025. And, from my look at it, the discussions about public safety or community safety, they often come from a place of fear, and they feature certain types of voices. So whether that's certain homeowners or certain business owners. And there is some misinformation there, because there's often the framing that homelessness is an individual problem instead of the truth that it is multi-system failure. And it makes assumptions about people who are homeless, when we know in reality that homelessness is caused by, systemic gaps, by barriers, unaffordability, lack of access to services. And, we are unfortunately not considering people experiencing homelessness, people who use drugs, people who have been incarcerated as part of community and as part of public safety. We do not consider their safety, their dignity, their right to basic necessities. And we've seen this borne out in the data. So Toronto Public Health recently released an analysis, and in that analysis, they found that street-involved men die 24 years younger than average, and that street-involved women die 42 years younger than average. And these are really startling facts when we think about who we are considering when we talk about safety. But I do want to highlight some really great work that came from Social Planning Toronto, and they released a toolkit recently about talking about homelessness. And they outlined two different approaches that I think are really helpful when we're talking about homelessness, when we're talking about solutions that address homelessness, like building shelters and building housing. And those two approaches are the community-oriented approach, so stating that housing and shelter services improve access to care and service for everyone, improve access to housing for everyone, and that makes our neighborhoods healthier and our neighbors healthier. And then there's also the self-benefit approach, which, might look like the impact of if there was less visible homelessness in your community, what would that mean for you? So that creating a stable home for some means that you're improving the security of your neighborhood overall. Or that reducing homelessness will basically mean that your family can go to a park, can walk through the streets and not see people in acute distress. There's also the financial piece. So giving people shelter and housing reduces strain on services like emergency healthcare, on policing, on the carceral system, which all have knockdown impacts on the taxpayer. So I think considering these two approaches in communication, whether it is with individual stakeholders, whether it's in conversations with government, I think can be helpful as we try to move in a more solutions-oriented way and try to get people to go from NIMBY to YIMBY, ideally.
Thank you so much, Krishni. And some of what you just said actually tied in really well with what Michael was talking about, those assumptions that are made about folks that are street involved or dealing with multiple crises. If you have those human stories that are amplified, if you have people with lived experience in leadership positions, it starts to create a shift with some of those assumptions. So that ties in really well. Thank you so much. And Erin, I'm going to turn to you. Can you share a moment when cross-sector collaboration led to a win or success for a vulnerable individual or community?
Yeah, I think there's a couple of examples that I'll highlight. And I'll start at the individual level because, sometimes it's feels the most stark of what that win means at the individual level. So community safety and well-being plans, I'm sure everybody here is familiar with the concept. They've been implemented fairly inconsistently across Ontario for reasons that we don't need to get into here. But I think one of the places that we've seen a good implementation of them is, and it's not the only area, but it's an area that I'm very familiar with, is Grey Bruce. So the counties of Grey and Bruce. So they have an integrated community safety and well-being plan. They've got good governance between the hospital, the area police services, and the area social services. And through their situation table, and that's where addressing acutely elevated risk comes into play. There was a client that was accessing ER, like emergency room visits on a very regular basis, and was becoming increasingly justice involved. And through the collaboration that happened at that table, they were able to move that person into supportive, I'm going to say supportive type housing. I would argue that supportive housing doesn't exist in Grey Bruce, but they model it in different ways. And through that, the police and the hospital actually came forward and talked about the cost savings. And not that everything should come down to cost savings, but the cost savings that the intervention created. So, the supportive housing approach costs probably about what we all know supportive housing is going to cost, about $4,000 a person a month. But in a 6-week period, there was over a $16,000 savings between the police and the police and the hospital system. And I think I'll talk about this a little bit in my later in the discussion, but it's where we can get these interventions happening upstream further and further and further. The person decompensates less, so the trauma and the impact on them is less, and it makes economic sense to the overall system. So that's one example of a success that has been seen through that collaboration. I think London's also an interesting place. It with their homelessness response, and without a doubt not perfect, but they were able to, through a large donation that came from an anonymous donor, were able to facilitate a community collaborative process where they brought together the supports around homelessness supports in London and came up with a community designed concept that was able to get council endorsement and support. Now, implementation, getting the design and implementation, two different things, and obviously you don't solve these challenges overnight, but it was really interesting to see that whole of community approach to addressing it. And where without doing that first step of that co-design, that work together, that inclusion of lived experience, you're very rarely going to find success. So I thought that's another interesting one. And then a third one I will share, though I will declare a full conflict of interest on this one because it involves my spouse's organization, which is supportive housing in Guelph. So you saw the community health community health center, you saw Wellington County, who's the service system manager for housing, and you saw the addiction center organization come together to advocate jointly in order to, so they raised essentially private capital in order to build a supportive housing facility, and then were able to advocate for funding to create permanent supportive housing that has housed, and I forget the specific number, but has housed people for over a year now, with lots of stability. I don't want to get my numbers wrong, but with lots of stability. All of these examples show like these interventions come when it's cross-sector collaboration, right? It's not one organization trying to do something by themselves. It's when the community comes together, shares some joint values about what needs to happen to create an intervention, whether it's at an individual level or at a systems level. And when those things happen and that collaboration happens, things start to change on the ground.
Thanks so much, Aaron. Absolutely. Those are really great examples of collaboration. And I like your first example, sort of highlighting that individuals are rarely just part of one system. And if you sort of look at the journey that somebody's actually gone through and the multiple systems that they've been involved in, sort of providing just that supportive housing piece has multiple savings and really benefits the individual, but so many cost savings as well. Thank you so much for that. So we're going to close out this conversation with the last set of questions. And here we want to look ahead to what's possible. Where are the opportunities? So I'd like to invite each of you to share your vision for a more coordinated, inclusive system, one that's built on collaboration, understanding, and long-term investment in communities. And Krishni, I'm going to start with you. How can we shift the public's perspective into seeing and understanding that supportive housing is an investment in safer, healthier communities?
Thanks. I think it can start at grassroots and local levels, and there's lots of really great examples of how supportive housing has been actually really well integrated into neighborhoods and into communities. And just thinking of an AMHO member, they're called Margaret Supportive Housing, and they're based in the city of Toronto. They have created such great relationships with their neighbors and their neighborhood association that their neighborhood association actually regularly fundraises for the women that call Margaret's their home. So I think there is a lot of really great work that service providers can do with their neighbors to build those relationships and build that respect, and that takes time. So I think the work that they did was to, work with their tenants, work with their staff, to go out into the community and to go to community events. And similarly, the neighborhood association was very welcoming, appreciative, and involved with the work that Margaret's was doing. So I think there are some really great examples across the province of, housing and other service providers that work well and integrate well into their communities. And it requires that bi-directional work. But we do also know that there are communities that are not going to be as welcoming and accepting, and then a lot of work still needs to be done. So I think some of the work that we've been trying to do at AMHO and that, our partners at both AMO, AMSA, and NASDA have done is to share some information about the benefits of supportive housing and the benefits that exist for the individual who's accessing housing, but also those benefits for the broader community and also overall the province. So, I think we know that supportive housing provides those spaces for people to have an affordable place to live, to get the supports they need, and ideally to thrive. And we've seen through reams of evidence that once folks are housed and they're stably housed, they're able to pursue wellness, better health outcomes. They're able to access employment, education, and be much more integrated into their communities. So housing is that key to success, pun intended, for people to actually get back on their feet. So, a lot of research has shown those positive mental health and substance use outcomes, but also just positive well-being overall. And I think it's like beyond the moral imperative to want to end homelessness, we also know that it gives individuals the opportunity to become more contributing members of society while also, pursuing their own wellness. And then on the other side, if we're thinking of the kind of community and system-wide benefits, you were mentioning earlier, Sophia, about some of the costing pieces. And so through some of the work we did through our research report, we found that a month in a psychiatric hospital can cost over $31,000 a month, that an inpatient mental health stay costs around $17,000 a month, correctional facilities are at around $11,000, but supportive housing, depending on the level of support, can range from anywhere to $2,000 to $5,000. And so just as an economic investment and as a sustainability piece, keeping people stably housed means they are not accessing these more expensive systems. And at the individual level, it means they're not getting re-traumatized and escalating into crisis repeatedly. So we're seeing the shift in public expenditures and then also the benefits at an individual level. And I think us as advocates, as researchers, as policy people need to do a really good job of articulating both the individual and economic benefits, because every time I talk about it to people who maybe have different opinions on housing and homelessness, it does start to shift their mindset of, are we actually doing the right things by focusing on more carceral approaches or focusing on, high cost systems like hospitals and emergency departments? And then just the overall community benefits that come from more people being contributing members of society and fewer people being in crisis. You can see the revitalization of neighborhoods. You can see people feeling more safe. You see more engagement in community activities in your neighborhood, pride in where you live. So I think there's all of these knockdown effects that's important for us to highlight. So instead of us focusing on, the scourge that is homelessness, I think it's impingent upon us to talk about the multiple benefits that come with investing in housing, and to get people on side with realizing that the solution to homelessness is not, through the correctional system, but it's actually through investing in housing, health services, social services.
Thank you, Krishni. Yeah, there's so much messaging there, and sometimes it really does come down to boots on the ground, having those discussions, conversations, and changing hearts and minds. I appreciate that. Michael, I'm going to turn to you next. From AMO's perspective, how do supportive housing models contribute to broader community goals like safety and economic vitality?
Yeah, I would say that just to start with is that AMO as an association is definitely making those connections between supportive housing and broader community goals, and reflecting that in what we say to the government and to ourselves. And I would agree with Krishni's earlier comment that supportive housing is a game changer. AMO would agree with that. We believe strongly in a targeted focus to grow the supportive housing system because it will contribute to those broader community goals that you mentioned. We are promoting it, as are others, as the primary solution to homelessness, both for those experiencing homelessness, but those that are at risk of experiencing homelessness. And, as was mentioned, we know supportive housing is an effective way to house people with complex needs and high acuity health conditions. And it is a viable alternative to living in encampments, especially for those with mental health and addictions. So, and we view homelessness as the most extreme form of poverty, and that carries risks for both individuals and communities. We know it impacts residents' health and well-being. lot of our elected officials are talking about the impact of poverty, that they believe that it's leading to increased public disorder and social unrest concerns. And I would say that, AMO's take on this is that it's not an individual problem, it's a systems failure issue, and that we really need to address the root causes. But, people are saying that the situation is escalating and not in a good way. There's other impacts that poverty has on communities, such as lowering workforce participation, but we also know that it exacerbates the homelessness crisis. So, we've used supportive housing as one way out of the poverty cycle for many to achieve housing stability. As was mentioned by Krishni, there's a clear business case for more supportive housing. There's a return on investment and the cost avoidance potential to other systems, provincially and municipally, including hospitals, emergency response, and the justice system. It was well established. We all know that it's more effective and more cost efficient than putting somebody in jail, hospitalizing them, or putting them in a shelter. And I know that I've learned these studies from reports from AMO and John Howard, that for every $1 invested, it results in approximately $2 in savings in provincial systems, including healthcare and justice, as well as the emergency services delivered by municipalities. Though it's been a bit of a challenge to promote that cost avoidance argument, but we think it's a powerful one. But getting back to the models and what would work. Well, I would first say that the government needs to be prepared to pay for what's needed up front to realize these benefits over the long term with the right models in place. We know there's a subsection of the homeless population that cannot be well served in community housing, transitional housing, market housing, or even in most supportive housing. That's what I've been told by our municipal service managers, that we need very intensive supportive housing models, more than so that's currently available in most cases. And I know Dr. Bazari talked this morning about Dunn House and social medicine. I think those are interesting things to follow, to see whether they can be scaled up and across the province. It's happening in other places, like in Sudbury, through a partnership through a housing provider and a hospital, and that's generating results and has great potential. And I know there's many other examples across the province that could be scaled up as a best practice. I would say that AMO is supportive of the Provincial Heart Hub initiative, which, as we know, provides treatment-based supportive housing, but we also promote the continued need for harm reduction models. So we believe that there's a place for both. It's not an either-or proposition. So, in closing, I would say that municipalities and sectors need to come together with the provincial government. We need to figure out what's needed, what works, and what it will cost to support these models in the province.
Thank you, Michael. As you highlighted, there's so many intersecting issues, but at their core is this homelessness crisis that we find ourselves in, and we definitely need a range of housing models and service models to make sure people have what they need to be supported. Aaron, over to you next. So this is a bit of blue sky thinking. If you could redesign one part of the system tomorrow, what would it be? Who would you bring to the table, and what misconception would you address?
I mean, I think this is something I've been chatting about over the course of the last couple of months. I think I spent a little bit of time thinking about this because there's multiple areas, but I do think there is one in particular that has the largest potential impact, which is we need to reframe social spending, healthcare spending, justice, all of these areas that we're talking about. We're talking about downstream, the prevention of downstream impacts. We need to reframe how we talk about the spending and investment in those as social infrastructure. As we move into what I anticipate to see this afternoon as a budget that is heavily focused on capital infrastructure funding with service reductions across the operational continuum of services. It's really important that we start to reframe the narrative of the work we do in terms of social infrastructure. The infrastructure projects, whether it be housing, whether it be the development of natural resources, whether it be the investment in nuclear energy, do not happen without the social infrastructure that we are talking about. And so we really need to work hard to reframe everything that we do in terms of a social infrastructure narrative. So that means getting crystal clear on what the downstream system savings are of the investments we're making. How do they contribute to economic resilience? How do they contribute to community safety? How do they contribute to economic development within a community? And I don't mean to move us past the moralistic argument of the human rights-based approach and the importance of those things, except those arguments are not currently uh, uh, persuasive enough to attract the investment that we need across the system. We really need to reframe it as infrastructure spending. And in terms of I think the misconception that addresses is that this is supporting someone who has made a poor decision in life from somebody else's perspective. I'm not saying that they've made a poor decision, but that's their perspective. It reframes that misperception into, actually, it's regardless of how someone got there, this is still better for the community, it's still better for society, and it's a really important investment to make. And in terms of who to bring to the table, I think it's treasury boards at the federal and the provincial level, in terms of having a conversation about how does budgeting happen when you make an investment in one area and it creates a cost savings in another. So you make an investment in good good early prevention that's paid for by the Ministry of Children, Community and Social Services, and it creates a health saving. Or if you pay for a homelessness intervention through the Ministry of Housing and Municipal Affairs, and it creates a health savings or a justice savings. These things need to be looked at as a whole of government investment, not as individual ministries. And it's a conversation that we need to start leading as a sector.
Thanks, Aaron. I really like that reframe, and I think it speaks to, I think, what Krishni mentioned earlier. It's multi-systems failure, and so it doesn't matter who's at fault and what blame there is, but it's about the path forward and how the impact of doing nothing or not doing enough. Thank you all so much for sharing your insights and perspectives. This has been a great discussion. We'd like to turn now to the program spotlight. So we're going to shift from these bigger picture discussions to a real world example of some of these themes in action. And I'm very excited to introduce Robin Holmes, the Assistant Executive Director with the John Howard Society of Kingston and District, who's going to talk to us about Pathways Supportive Cabins Project, which is a great initiative that's an example of cross-sector collaboration and meaningful investments into housing and wraparound supports for 25 individuals who were previously experiencing homelessness in the Brockville area. So I'll turn it over to you, Robin.
Perfect. Thank you, Sophia. So before I begin, I just want to make note that this presentation is brought to you by cold and flu season and a questionable amount of Mucinex this morning. So I support every one of you being here in helping me get through this presentation. So we'll do this together. So I'm just going to share my screen, have a little PowerPoint to share with you because I don't think you can really get a full sense of our program without seeing what it looks like. All right. So as Sophia mentioned, I am the Assistant Executive Director for the John Howard Society of Kingston and District. Our agency covers programming from Hastings right through Eastern Ontario, through Kingston, Frontenac, Lennox, Addington, and Leeds and Grenville. So we are quite large in our service implementation area. My role oversees all of our Leeds Grenville programming. So I carry a portfolio that oversees staff in housing, justice, and youth services. One of our programs being the Pathways Supportive Cabins Initiative. So this presentation will provide kind of a high-level overview of our Pathways program. And I acknowledge that the data contained in this presentation is reflective of that completed in our last quarter, so that ending June 30th of this year. So for those of you who are not from Leeds and Grenville, we are a county that encompasses 3,300 square kilometers with a 2021 census population of approximately 104,000 individuals. For an area that size, we have a single domestic violence shelter for women and children and a single overnight emergency shelter with 20 beds, which at this point is facing an uncertain future. So much like other communities across Eastern Ontario, homelessness has been an increasing priority over the past few years. The COVID pandemic specifically resulted in a drastic shift in our housing market. We saw rentals become increasingly financially unattainable for many vulnerable clients. Our local by name list typically sits around 140 individuals experiencing homelessness. As an agency, John Howard Kingston and District has been in partnership with the United Counties of Leeds and Grenville as a key player in the long-range plan for addressing housing and homelessness in our area. Prior to the Pathways Supportive Cabins initiative, we ran other community-based housing for vulnerable youth and adults. We also helped lead an encampment response protocol, which promoted humane, dignified responses to encampments. In 2024, as housing remained a significant priority in our area, the local Joint Services Committee made the decision to fund a supportive cabins initiative. We submitted a proposal to be considered as the organizational lead, and we were fortunately selected. We were able to offer unique supports to clients as our staff are equipped to support individuals for whom their criminal justice involvement is significantly contributing to their homelessness. We had the opportunity to be actively engaged with the planning process with the United Counties. And during the construction of our site, we had regular meetings with the staff from facilities, communications, the housing department, and more to ensure the collaborative approach to this project. So today I will discuss with you the community consultation that led to this implementation, our current supportive cabin implementation, and what the future looks like. One note I will make before starting was that there has been a lot of discussion during the panelist section about cross-sector collaboration. One thing that we were fortunate to participate in with this implementation was a public town hall. So we decided as an agency in collaboration with the United Counties that it was really vital to portray that this was not in fact a siloed approach being delivered by the John Howard Society or by the United Counties, but rather was in response to a collective community need for housing responses. So what was held was a town hall at our local arena, which allowed for individuals to attend, to ask questions of our agency, of our local Joint Services Committee representatives, and also of emergency response reps from police, fire, and paramedics. And we really felt that by doing so, this conveyed that we were all in this together. It really also helped to break down some of the misconceptions that it is kind of an us versus them with the police and emergency response. And it really facilitated some productive conversations with the neighbors who are adjacent to our unit. So as you will see here, we are very fortunate to have our site directly along the St. Lawrence River, which is a beautiful area for us to be located in. At the top of this picture, you will see a couple buildings with 3 large tanks. That is our local water treatment center. So the cabins you will see just south of that along the water. This was really a unique site in that it actually belongs to the city of Brockville, but was leased to the United Counties as the municipality, and then basically turned over to us as John Howard for operations. So it was one of the few times that we've really seen collaboration between different levels of government in addressing homelessness locally. The funding for the operations for the Pathways Supportive Cabin site was provided via provincial HPP or Housing Prevention Programming funding, flowed locally through our United Counties. So what is our program? So essentially, we say that it is a program first with housing attached. It provides temporary accommodations to individuals who enter our site. Currently, the funding existed from November of 2024 to March of 2026. We are very confident with the current implementation and the successes that we will see this continue. The expectation is that clients be following their participation agreement and be actively engaged with a caseworker. What this means for the clients is that they set individualized goals and then pursue them with assistance from our caseworkers and our program managers on site. The ultimate goal is that individuals will be equipped with robust skills for daily living, a multitude of supports from our community agencies, while having the opportunity to pursue long-term sustainable housing. The length of stay will vary for participants depending on their needs. While they are living in our units, they pay their ODSP shelter allowance or Ontario Work Shelter allowance directly to the United Counties. What we found was by implementing their shelter allowance during their stay, it allowed for a very quick turnaround if they were able to sustain long-term housing. We could just simply switch who the recipient was of their shelter allowance to assist them with a smooth move out. We are a harm reduction site. There is no requirement for abstinence for clients to reside at the Pathways Cabin site. Our staff engage in open communication with clients about their use in terms of the substance type, frequency, and method of consumption to mitigate any risk for drug poisoning during their stay. All clients have access to harm reduction supplies, on-site, and safe disposal containers. While they are residing with us, we help them have access to support with a variety of local services. So whether that be mental health, addictions, connecting to primary care for those who have not previously accessed a doctor, provision of harm reduction supplies, as I mentioned, and also accessing employment, vocational opportunities, and developing a social network that they have not previously had. So our staff assist with providing various workshops, both on-site and in the community, to ensure that while residents are living with us, they are not only accessing services on-site, but also continuing to access their support systems off of our location. This is what one of the cabins looks like. So for anybody who hasn't seen a supportive cabin unit, there are 25 of them on our site. We have 2 that have accessible access via ramp. If you look at the picture on the left, you will see that each cabin is equipped with a double bed, a microwave, a mini fridge, a desk, chair, and there is shelving mounted to the wall on the wall that you actually can't see. There is a secure site, so there's a fenced perimeter of the site. Guests can come and go as they please. The gate is simply to restrict who can come on site. So it is a protective feature for the residents to ensure that they have a safe place to lay their head at night. But as I said, they can come and go as they please. We have a no guest policy, which we were a little apprehensive about implementing that at the beginning, but it has been incredibly successful, and our clients have actually expressed an extreme appreciation for this as they navigate trying to remove themselves from previous social engagements with other individuals who may not be pro-social. They've really expressed that this type of controlled site has allowed them to really have some hard boundaries in terms of what is a safe place for them to just kind of end those relationships at the gate. We have a minimum of 2 staff, usually 3 at this point on site at all times, 24 hours a day. This includes program managers, caseworkers, and support staff. We were able to request ample lighting and security camera coverage when the site was constructed. So we really have a lot of safety considerations on site. We also provide for the residents on site 1 meal per day, which is provided by a local caterer. It is delivered as a hot meal in the afternoon in a microwavable container that, should a resident decide not to access it at the time of delivery, they can simply take it to their cabin or to a common area and reheat and eat when they are hungry. The meals, we have really worked to make sure that they are healthy and hearty meals with lots of protein, things to keep their bellies full, and keep them in a place that they are really able to address their individualized goals, because we know that this is incredibly difficult work that our clients are engaging in. So last time I was down there, they had a wonderful dinner of spaghetti and meatballs with garlic bread. So I hope it tasted as delicious as it smelled, because it looked absolutely wonderful. And on the right, you will see on the bottom of this slide, we really tried to engage the community with every aspect of the implementation of this program. So here in this picture, you will see Clarissa, who is a local 6th grade student, and she decided that when she heard about the cabins being implemented, that every resident should have a welcome home sign on their cabin. So when they moved onto the site, they were met with that welcome home sign. And also then, as you see on the bed, with some of the goodies that we provide them. So everybody gets their own cutlery, their own plates, bedding, towels that is theirs for the duration of their stay. Things to just really say kind of welcome, although this may be a temporary home, that we value you, and these are things that we have provided for you. In addition to the actual cabins, we have common spaces on site. So you will see here on the top left the auxiliary washroom trailer. There is 6 self-contained washroom units on this trailer. One is fully accessible, that has full turning radius should it need to be wheelchair or walker accessed. These washrooms, as you will see on the bottom, each are self-contained units, so they each have a toilet, shower, sink. And I have mentioned in my previous presentations that the residents very quickly realized that the mirrors in the washrooms are Bluetooth equipped. So they were really happy to be able to play their music during their showers, which we all found pretty comical, but was such a nice little welcome surprise for them. And on the bottom right of the slide here, you will see the auxiliary trailer that has common areas in it, that also contains the kitchen that you will see on top. So that trailer contains our kitchen, laundry, large programming common space, and a smaller office area for private conversations. Typically, when I'm down on that site, we have individuals engaging in art activities. They really enjoy puzzles or just sitting and gathering kind of in an inside environment. So that trailer is very well utilized on site. This gives you a pretty good understanding of the demographics of the residents that initially moved onto this site. So as I mentioned in my introduction, our local by name list, or the coordinated access list, typically sits around 140 individuals, and our residents for the cabin site are selected specifically from that by name list. We work very hard to ensure that the individuals we move on site are those who have experienced homelessness for the longest in our local community. So some of the considerations that we take into account when we're looking at our next round of move-ins is a willingness to participate. So a lot of our clients, of course, have lived rough in encampments or experienced various degrees of homelessness for significant periods of time. We do not expect by any means that they are actively involved with our caseworkers 24/7 a day. We had somebody say, is this going to be like summer camp where you wake me up at 6 a.m. with a whistle? And absolutely not. We expect them to be engaged with our workers, but also have a degree of autonomy in deciding what that looks like for them. So they have to be able to also live in a communal setting, because there are 24 other individuals on site here of various levels of acuity. And we also have to make sure that there are no current court conditions or non-com orders that would be prohibitive of somebody living on site with others. Whenever possible, our engagement starts with the client weeks to months before their intended move-in date. Of course, sometimes we facilitate very last-minute move-ins, and that's definitely possible. But we have found our greatest success when we're able to really engage with the individuals, look at what their goals are, and have kind of a really good footing with them before they even move in. It has allowed for smoother transitions and a greater relationship to be developed with our staff. In terms of community collaboration, as I mentioned, they have an access to a multitude of community supports on our site and community-based partnerships. Our services are rooted in a systems navigation approach, so we work collaboratively with individuals and agencies in a wide variety of sectors. So currently on site at the cabins, we regularly have representatives from the community paramedics and their summit team, which is the SUAP, or Substance Use and Addictions Program investment. We have the health unit on site for tobacco cessation, mental health and addictions on site for case management and delivery of recreation supports. Legal aid has delivered a clinic on site, and we've also had strong involvement from our local employment and education center. One of the most unique things that we have been able to do on this site is that we were able to hire 3 of our residents to serve as maintenance representatives on site. So we, as a living wage employer, we were able to hire them. We engaged them in a full panel of interviews. So the residents had to apply, express an interest in the position, go through interviews with our local employment and education center, sign contracts, and undergo a full round of onboarding, as would our employees at John Howard. So they are now on our payroll as living wage employees and will be assisting with maintenance on site, which we are very proud of for these 3 individuals. So this chart here kind of just provides a high-level overview of the types of service accessed. You will see there is life skills support, training and employment, identification and financial supports are typically one of the first things that our staff are doing when individuals come on site. If an individual requests a support that we have not previously implemented, we are always about being creative and finding solutions that we have not previously engaged in. So we really work with each client individually to find what they need and then offer it in a way that is accessible to them. Beyond the numbers, though, so when we look at a 25 individual site and the number of individuals who are really accessing harm reduction supplies or food supports or medication supports, what we are really most proud of about this site is the significant achievements of our clients during their time with us. So since coming on site, this program opened in February of this year. So we are not even a year under our belt yet. Since coming on site, we have had 2 residents be equipped with eyeglasses and able to see for the first time in their life. We've had multiple clients obtain methadone carries because they have an address to which they can take them home. We've had 2 clients begin nicotine treatment and no longer smoking cigarettes because of their involvement with tobacco cessation with the health unit. One client, again, began attending regular mental health sessions after being previously very resistant to engagement. One client is equipped with extensive medical supports on site, which include not only a PSW, but also occupational health and physical therapy. We've seen also individuals successfully complete their probation orders, complete the PAR program. One client expressed that for the first time in many, many years, he has been out of custody for a full 12 months, which is a huge celebration for him. Just last week, we saw one client kind of be reunited with family after that family member having to basically cut ties and set some hard boundaries during their period of homelessness. And also last week, we moved one of our highest acuity clients into a longer term supportive housing facility that will allow her to continue receiving support from us while waiting for one of the social housing units with our local registry. One of the biggest things that we saw, though, which truly I didn't think would be possible, was one of our residents on site was able to successfully complete a full round of 6 cancer treatment sessions at the Ottawa Hospital. So this was facilitated in collaboration with our staff and the ODSP disability team locally to ensure that every time this client had an appointment that they were provided with transportation up to Ottawa. They stayed for the day for their treatment, were transported back to site, and then our staff assisted with ensuring that they were well cared for during the night after their treatment. So seeing an individual being removed from homelessness and able to successfully complete that treatment while on site was an incredible success for our staff. So after seeing the successes, we naturally look at, as anybody who has met me will know, I don't sit still well. So I am always one to ask, what is next? What are we doing now? Which my director is always so thankful for. But what we are seeing now is this building that has existed on the site of the cabins. I'm scrolling the wrong way. There you go. Is actually going to be utilized for an additional 25 beds on site. So we are going to be increasing our capacity from 25 to 50. This building that you see here was previously utilized as a dormitory for a local private school. And since the opening of the cabin site has served as staff offices, storage, and common spaces for residents. This has now, thanks to a separate provincial investment, undergone additional minor renovations to include the additional 24 beds that we will be welcoming on site. This will bring our site total, depending on if we use one room as a double or a single, to either 49 or 50 beds, and our agency total to around 63 beds for homelessness supports locally. This expansion is a major milestone for us. It reinforces our commitment to addressing homelessness in our community. But as I said, this is by no means the end. This is just a step very much, I think, in the right direction for us. So as I said, within our time restrictions today, this is a very high-level overview of the Pathways Supportive Cabins program, but I very much appreciate being able to provide this program highlight today. If anybody needs to reach out to me, this is my contact information. I'm always happy to talk to other communities who are looking at implementing a similar program and to answer any questions that anybody may have.
Thank you so much, Robin. It's great to see those successes and the community response. Those welcome signs, I think, are really, really nice to see as well. A couple questions for you, and then we're going to open it up to the audience Q&A. But the first is, through research and real world examples, it's been shown that sustainable investments in housing can help break the cycle of incarceration and homelessness and lead to better outcomes for vulnerable individuals in our communities. From your perspective, are the cabins showing to be the right investment? And I think you touched on this in your presentation, but if you can expand on that for us.
Absolutely. Yeah, I think we maintain as an agency that, cabins are just one option. And, we really do support that clients should have access to a wide range of programs and be able to find one that best meets their needs. That kind of being a full spectrum of supports from emergency shelter straight through to long-term housing. But that being said, the supportive cabin site has provided such a unique method for us to address issues that exist for individuals with criminal justice involvement. So this project has really allowed us to utilize our position as a known collaborative agency locally, as well as the co-chair of the local HSJCC, to advocate for some real systemic change. Our hope is really through this site and through our other agency programming that we can reduce the barriers to housing and practices that perpetuate the cycle of homelessness for individuals who are either currently incarcerated or being released. As I mentioned, I touched on some of these things in my presentation, but since we opened the supportive cabin site, we have seen individuals able to engage in therapeutic treatment courts, such as mental health court. We had one client who was able to engage in mental health court specifically due to his residency at the cabins, and he has remained actively involved in that. We've also seen individuals able to access consent release, bail supervision due to the supports available on site. And we have seen individuals able to resolve charges through modified periods of incarceration, such as intermittent sentencing, allowing them to maintain their housing at the cabins while serving that term. So this program has strengthened our relationships with not only our local police agencies, but also with our core personnel and other justice serving agencies. So we have truly seen it as a very well-used investment.
Amazing. And the last question for you before we open it up, how does failing to address homelessness shape the way we see and treat one another? And what risks does this pose to the stability and cohesion of our communities?
Yeah, so I think Krishni touched on this really well earlier, that the failing to address homelessness impacts our community at multiple levels. So yes, of course, it increases the impacts, like the burden financially and in terms of personal resources on systems such as policing and healthcare. But it also denies the ability of individuals experiencing homelessness to more meaningfully contribute to our communities and be engaged with them. So whether that be opportunities for them to seek employment or volunteer opportunities, engaging with social rec, or benefiting from mentorship from other residents in our community, we're really denying these individuals those opportunities by not investing in homelessness. And what we really see with our agency is that when we fail to invest, we are perpetuating the cycles of multi-generational poverty and homelessness. And that disrupts access to education and other systems of care that ultimately we want everybody to have access to. So, visible homelessness, it creates stigma. It just perpetuates an us versus them. And really, we feel, and our staff have had so many conversations about failing to invest really conveys an attitude that individuals experiencing homelessness aren't worthy of our time and efforts. And that is what we at John Howard Kingston work every day to kind of fight against and advocate for better responses to.
Yeah, thank you so much, Robin. I think that was a thread throughout all of the panelists, just changing that narrative and talking about that social impact and connectedness that we all have on this issue. I think I turn it over to Michelle now. We do have some questions that have come through, so I think we can take those.
Wonderful, thank you. And I will go ahead and ask the rest of the panel to join us as well, as the questions are for everyone. And maybe while they're coming together, I will There was a question for you, Robin, and it was just someone noted that they really applaud your initiative. It seems that many systems kind of came together to access the funding, and they wanted to know how you're managing drug use on site.
Absolutely. So, this was a really tricky thing because we knew obviously inherently there's risks with drug use on any site. What we really did was engage with active communication and policy and procedure development with emergency response prior to the site opening. So we were very open with police, paramedics, fire about harm reduction, what that looked like to us, and what a response would be from them if required. So our policies right now are that personal use is prohibited on site, but selling or giving to other people, any type of joint consumption is not allowed. What we have seen on site is, as I mentioned, our staff are having really open conversations about what are you using, how much, when, and how. And just like about 2 days ago before I left, I'm actually in BC right now, but before I left Ontario, our program manager actually said that one of our clients came to us and said, hey, I'm gonna go do a pickup right now, and having some anxiety about it. And she said, "Can you just bring it back here?" And we want to know that if you're using, you are kind of within our supervision and that we can help you kind of mitigate your risk. The client actually came back and said, once you're given permission to do something, it's really not as intriguing to do it anymore. And didn't use that night. So obviously that's an ideal example. That is not the reality for most of our clients. But what this drug use looks like on site is that we are encouraging not only our staff to be mindful of the use, but also other residents. Other residents have come to us and said, hey, my friend over here in cabin, whatever, I think he's having a hard day. Can I just get an extra naloxone kit in case something happens? So increasing awareness of the use, increasing awareness of the supplies available to them, and creating a site that is free from judgment and stigma. What we see on site, and we are continually praised from community partners, is that when they're on site, the site is pristinely clean, because our clients don't have any fear about walking out and disposing something and being judged. So we're able to just facilitate those conversations. We ask clients, if you need to be in your cabin and using, then tell us, we'll check on you. And we have even revised some of our policies before. So we used to have a policy that nobody could be in somebody else's cabin after 10 p.m. And then after doing some kind of reflection on that, we were like, that's really not a harm reduction approach, because we encourage people to use together and kind of not use alone. So we've revamped some of our policies and have open conversations, and so far so good. We've had very minimal police calls, and our emergency response calls have been for medical responses, not for overdoses. So
Great, thank you so much, Robin.
thank you.
Michael, we have a question for you. During AMO discussions, have there been any innovative ideas discussed about how to get more supportive and transitional housing models built quicker? For example, they said co-owned models, municipal loan programs from NPOs. Do you have any thoughts on that?
Sure. Well, I can say generally, we do work with municipalities in the province to accelerate housing generally through innovative methods, including best practices promotion within our municipal members. We haven't done specific targeted work on supportive and transitional housing, but I think that's probably something that maybe AMO could explore with our OMSA colleagues, because they know the situation on the ground much more than AMO does. But one thing I would add to that is I think we're looking to the potential of Build Canada Homes right now, with their commitment to providing capital to build supportive housing and transitional housing. We know their goal is to build faster and at a large scale and using innovative technologies like modular housing. So I think that might be an area where there could be some conversations. We've reached out to Build Canada Homes and said that we'd like to have some conversations with them, with our municipalities and our district social service administration boards. So I think something could come out of that, because I think that dovetails with those goals.
Thank you, Michael. There was a general question for the group asking, they noted that, Ontario seems to be lacking political desire to house people, and we've seen a shift from the government towards criminalizing homelessness. How are you pushing back against this? And that's open to the group. Who would ever like to jump in first?
I can start Michael, if you want to go for it, go for it.
No, go ahead, Krishna. I
Okay.
already have a question, so good.
I think it's a really valid question, and I think I refer back to this United Nations concept of social recession a lot, and I feel like I'm pulling on it more and more, which is in times of economic uncertainty, people move from more of a community-minded approach to more individual protectionism. And I think that is a lot of what we're seeing right now. But I think, a lot of things that were discussed in this conversation, some of the pieces Aaron brought up about, reframing things as social infrastructure, trying to get a whole of government, insight into pieces like working with Treasury Board Secretariat, working with Premier's office, with Cabinet Office, are ways to shift the mindset from, again, the individual blame of someone experiencing homelessness to a systems level solution. And I do think, though there have been a lot of setbacks we've seen with policy and legislation, I have seen shifts, in provincial messaging and provincial investment that does center housing. So we've seen the Heart Hub investment. It is quite centered around supportive housing. We're seeing Build Canada Homes at the federal level, again, with significant investment in transitional and supportive housing to address homelessness. So while I think there is a lot of ground that needs to be made up, I think even just seeing the word supportive housing in provincial, federal, and also municipal announcements and investments is a step. But I think knowing that we are in this kind of crisis context and knowing that we are in a period of great economic uncertainty, I think it's important for us when we think back to messaging. Perhaps a community-oriented approach is not the right approach right now, and it's beneficial for us to use that self-benefit approach of this investment in housing will cost the system less, it will make communities safer, and it just makes the most economic and safety sense to make those types of investments. So that's the approach we've been taking with government, and I know a lot of other folks have. And we're going to continue to do that, continue to use evidence, and try to shift some hearts and minds. But I'll pass it over to other panelists if they have other pieces to add.
Thanks, Krishna. Michael, did you have something you wanted to add?
Yeah, sure. I'll jump in. It's a good question. Agree with what Krishna said. We know that responses vary by municipalities, provincial government, and the federal government to put in the investments that are needed for this. I do agree that we need to change the narrative a little bit. So Amo was talking about our poverty reduction narrative within the context of reducing and ending chronic homelessness. And I think part of that is talking about the benefits of what housing stability incomes can provide to the province through cost savings, but also, there are big focuses on employment. And for some people, you need housing, for all people, you need housing stability before you can get a job, knowing that not everyone in supportive housing is going to be that close to the labor market. But I would say, as a general comment, I think sometimes there's finger pointing between governments about who's going to make the investment. We see that provincially and federally, but do see an opportunity again with Build Canada Homes, the investment that the federal government is putting in. They have asked, and AMO is supporting this call, that the provincial government, the provincial government pair the federal investments with wraparound supports and employment supports. So I think there's some opportunities there that we could look at. But generally we're working with the provincial government and the federal government in the lead up to both their budgets, using the homelessness report and data gathered there as evidence to inform our advocacy.
Thank you, Michael. Aaron, did you want to add anything, or Sophia?
I think I'm good. I think Michael, Christia took care of.
Sounds good. Okay, I'll move on to another question. Somebody wrote in about they're in their region, they're running a housing program, and they've noticed that the biggest barrier that they're facing is the lack of adequate, accessible, and holistic supports from various sector partners. So they were looking, we're wondering, how can we build collaboration locally among service providers amidst the resource constraints that we currently have? Aaron, did you want to take this one?
Sure. I think collaboration is an intensive process, right? I don't want to underestimate the amount of time, resource, and energy that it takes. Except nothing starts getting better until we start to collaborate, right? And so I think the keys that I have found throughout my career in the last 15 years of working across the broader social service sector is getting the right level of decision maker to the table. So someone who can actually, I think collaboration sometimes sputters when the person who can, for lack of better word, bind an organization to an agreement on collaboration isn't present at the table. And that's where it can feel like maybe it's not worth the time. But I think getting the right level of decision maker to the table, and then it really is, I think there's, in a lot of cases, the need to actually set out some protocols, right? So and this isn't directly related to housing and homelessness, but one of the more successful examples I've seen of this in my career was in the region of Waterloo, establishing a transition-aged youth protocol between the youth system and the adult system, and it really defined what are the behaviors of the systems and what's the behaviors of the clients that are required at each stage of that transition in order to make that transition successful. And I think we can think of like taking that and applying that to other systems, whether it be transition from justice into the housing or transition from health into housing. But it is really about defining so the collaboration is about what is defining those behaviors and the expectations on each system's side, and then using that protocol as a key accountability tool of, is everybody following through on what they committed to in order to deliver the intervention we need for that client.
Thank you, Erin.
I can
Krishni, did you want
add
to
to
add
that.
anything from the operational side, or Robin, go right ahead.
Just to completely add to what Erin just said, as has been mentioned a couple times in this presentation, there's really been a shift from funding investments from operational to capital investment, which I think has really put a strain on operations and frontline service provision. So it's just, again, it's perpetuating these challenges of wait lists and who is covering what between different agencies. And I think really what we have found has worked best locally is we've gotten angry about it and we've come together and we're like, this isn't okay. So, instead of us all just quietly crying and screaming into a void, we came together as agencies and said, these things aren't okay. We are not adequately serving our clients. And in those conversations, we were able to implement some kind of immediate responses to it in terms of offsetting each other and our responsibilities, but also coming together in a bigger picture to jointly apply for grants and different types of funding to address kind of the inefficiencies in our community. So I think, again, nothing changes until we identify it and we say there's a problem. So I'm just going to kind of validate that comment and say that things aren't okay right now. But I do see a way for us to come together all in our communities across the province and across Canada as a whole to really jointly say there's a need and we can do this together.
That's fantastic, Robin. And I think that's a great way to end this session today. I'm just being aware of the time. I appreciate the questions that we received from the audience. I'm sorry we couldn't get to them all, but this has been both an informative and an engaging discussion. To our moderator and panelists, thank you for taking the time out of your busy schedules to be with us today. It was great, and this will mark the end of our keynote panel, and we'll now go into a health break. I encourage everyone to visit the posters, presentations, exhibitor booths, and network with fellow attendees, and a reminder to please fill out the evaluation surveys. Please note that the B series concurrent sessions will start at 3 p.m. And to attend the session, just click on agenda and enter your session. And once ready, click on join session. Enjoy the rest of your afternoon, everyone. Thank you.